Welcome to Coruzant Technologies, home of the Digital Executive Podcast. Welcome to the Digital Executive. Today's guest is Luka Yancopoulos. Luka Yancopoulos, CEO and co-founder of Grapevine, is an entrepreneur with a track record of innovation and consistent delivery in the healthcare industry. As CEO and one of the faces of the company, Luka is involved at every level of Grapevine's operations, securing funding, innovating on the platform, and looking for ways to take the company's offering to an even wider market. Well, good afternoon, Luka. Welcome to the show.
Hey, Brian. I'm very excited to be here. Thanks for having me.
Absolutely. This is so fun. Appreciate you making the time, hailing out of the great state of New York. Always a fun time on a podcast, no matter where I do this, but appreciate, again, you making the time. So, Luka, jumping right into the question here, could you share the story behind Grapevine's inception? What inspired you to co-found the company and specifically target the challenges you saw in the healthcare industry?
Yeah, sure. I mean, I've got both my parents are in the healthcare industry. My dad's a scientist, my mom's a nurse. And for me, I was called to action by some of their needs they were facing the onset of the pandemic. I was merely a college student, but I saw my parents facing real issues, and it wasn't issues that they were equipped to solve, nor they'd been trained to solve. They were healthcare professionals, specialized in patient care and solving patient problems and curing people of diseases. And when, the pandemic struck, those frontline workers became struck with a problem of their own, a problem that would affect them and patients alike, but not something they could solve. And that was sort of supply chain failure. It was something they didn't have time to handle, especially during a time of great crisis.
Thank you. And I appreciate that. Every podcast here has such a unique story, and I love every single one of them. But the fact at the end of the day, there's a problem that needs to be solved. And a lot of times people aren't looking at it that way. It's just they've had some sort of experience, sometimes not negative, right? Traumatic. And it creates this need for the person or people to create something that will alleviate the pain or again, like I said, a solution to the problem. So I appreciate the share on that, really do. And Luka, healthcare facilities rely on giant suppliers. How does Grapevine help them escape and save?
Yeah, I mean, giant is the right word. And another word I would add to it is old. We like to think of them as distribution dinosaurs. McKesson's coming up on its 200th year anniversary, almost as old as our great nation of America. And my friends here, we sort of joke about the sort of old habits that have somehow kept their way in the modern era, and that, billions and billions of dollars of healthcare industry spend is directed towards. And it's incredibly inefficient. It's problematic. It causes a lot of the issues that people sort of face, not just during crisis time, but on a daily basis, right? Medical practices, 10, 20% of their annual expenditure is on medical supplies. That's not including even, a lot of the drugs used in the clinical setting. And it doesn't need to be that way. A lot of those costs come directly from the middleman, his markup, and supply chain inefficiencies. You've got a right in this day and age to be able to shop different sources and make sure that you get the smartest source every time you need to buy. And if you do that, if you were to go into every store that sold, let's just say, your favorite cereal, right? Every different grocer, within a 20-mile radius of your local home, and you went in every store and you looked at the prices on every single box of cereal, same brand, same size, across those different stores, you would see different prices. That's not a secret. A lot of these mega healthcare distributors like to keep information siloed. They like to keep their prices behind a closed door. They like to lock you into a contract as a healthcare business. And that's not the world that we're living in 2024. So it's Grapevine's responsibility to help break down the walls between your suppliers, right? Give you increased optionality without an increased headache, and make sure you get the smartest source every time you add something to your cart.
I love that. And there's so much inefficiencies. And we talk about this a lot on the podcast, whether we can leverage blockchain, which I think is amazing. And I think it really applies in supply chain. But AI and other things could certainly help cut into that cost, that supply cost. But also, we do need to look at the middleman. There is a lot of that going on across every industry, especially in healthcare. And I'm a healthcare person as well. I've been in it a long time. So I appreciate your insights on that, Luka. I really do. And Luka, managing lots of suppliers sounds really messy. How does Grapevine keep it simple for hospitals?
Well, I think you hit the nail on the head with one of our key special ingredients, and that is AI, right? When you come online to Grapevine and you sign up for free, you basically link the suppliers that you previously worked with. And when you do that, you just type in your credentials to henryschein.com, to mckesson.com, to medline.com, and all of your orders from all of those suppliers immediately flood in. Same with your contracted price. We rapidly learn what specialty you're in, how much you order, and what GPOs you might be a part of. And some of those things might not apply to you, but maybe they should, because when we look at the items that you previously ordered, we look at the prices. We say, hey, there's a business just like you right down the block or right around the corner, maybe halfway across the country, but they're the same size. Maybe they're a part of the same GPOs, or maybe they're parts of GPOs that you should be a part of. And we basically give you a checklist, a very easy checklist that can all be done and completed in a few clicks to basically leverage the lowest possible prices that you can access. Because someone else has prices better than you, you should be able to get those prices too. And you might never know that someone is paying 75% less on the same exact item from the same exact supplier. And information is sort of our job, right? So we give you a place to aggregate that information. You shop it as if it's a single supplier. Meanwhile, you're tapping into all the suppliers you would ever need and connecting with hundreds of new ones. And we make a really simple Amazon style checkout experience to shop, hundreds of suppliers in a single screen. And if you ever do add the wrong item to cart, or you add an item to cart and it's a terrible deal, that's where we show a simple pop that says, hey, maybe you should switch and save, right? And it shows maybe the same product from an alternative source, or maybe a cost saving substitute, an alternative brand.
I really love that because in the middle of the day, especially if you're a procurement specialist, right, you've got a lot of stuff to order and you don't have time to shop around, obviously, especially if you work in a large hospital. Been there, done that. So I appreciate really you leveraging the technology to make shopping, as I would say, or procurement much simpler, and obviously saving the hospital bottom line. So appreciate that. And then, Luka, last question of the day. What big changes are coming to healthcare supply chains, and how will Grapevine stay ahead of the curve?
Yeah, I mean, the changes that we're hoping to implement is to liberate all healthcare businesses of ever having to place an order again, right? Let people kick back and focus on patient care, focus on cutting edge medicine, focus on being the best possible clinician that you can be, and not spend hours or thousands of millions of dollars, right, on trying to optimize or manage this beast called supply chain. No, we see a world where you've got forever stock, your inventory shelves are always full, and you don't even lift a finger or click a mouse to make that happen. And all the while, we build a trusting relationship, an unbiased relationship. We don't hold stock, we don't have inventory, and we are not a supplier, right? We build a trusting relationship with the healthcare providers that we will always get them the best deal. We don't make money off of, what source they buy, and we don't push you towards a house brand because we make an extra buck off of it. Our job is to keep your shelves stocked and to make it as minimal effort as possible. And we want to do that while making sure you get the best possible price every single time, and you're not getting gouged, when gouging is a thing that continues to happen long before and long after the pandemic.
Absolutely. The price gouging has gone way out of control, and we've seen very lopsidedness, especially with the federal funding. We've seen a lot of cases where the people that really need it never got the money, and the people that may not have needed the money certainly took, I think, advantage of the system. And we've got to continue to work on that. And there's people like you, entrepreneurs like you, that are making the difference, because we're diving in and tackling the problem, across the whole spectrum, and not just leaving it up to some, bureaucracy or some agency or government agency to kind of weigh in on this stuff. So I appreciate that. That's huge, especially to the patients that really need the help. So Luka, it was such a pleasure having you on today, and I look forward to speaking with you real soon.
Thanks, Brian. It was great to be here. Thanks for the opportunity.
Bye for now.